Greetings, ladies and gentlemen. I'm Joseph Atick, Executive Chairman of ID for Africa, and I'd like to welcome you to the third and final episode in our trilogy on vaccination certificates and identity management. Before we delve into today's exciting series finale, I would like to make two quick announcements. First, while the world is making progress in adapting to new norms that permit the return of some of the activities we enjoyed prior to COVID-19, the progress has neither been geographically uniform nor steady. Factors such as lack of meaningful progress in rollout of COVID credentials, the slow pace of vaccination in Africa, the continued disruption of international air travel, and the uncertainty related to the lifting of current embargoes on very large gatherings in Africa make holding our annual meeting not feasible in 2021. As a result, and after consultation with our host country, Morocco, we have jointly decided to postpone our physical meeting scheduled for October this year to another date in 2022. To be announced later when we have better visibility on the course of the recovery. While small-scale local and regional meetings are likely to take place in Africa in 2021, our annual meeting does not qualify as small. Last time we held it, it reunited 1,500 people from over 90 countries around the world. Of course, we are disappointed, but this is a matter out of our control. However, I ask you to look at the bright side. As it is now evident, COVID has forced us to practice what we had preached. Effectively, we have accelerated the digital transformation of the ID for Africa movement, and we shall continue to leverage the virtual medium of LiveCasts and other engagement platforms that we have put in place to stay connected with our ambassadors and our community, and to continue the dialogue around the development agenda and ID for D. These digital tools have allowed us not only to remain operational, but to deepen and broaden our impact. We expect to operate in a hybrid physical and virtual model, even as we resume meetings in person in 2022. Okay, second, I'd like to share with you what is coming up next, something very exciting. On May 26, we are conducting a major session on building trust in the democratic process. This is going to be another mega panel made up of 3 subpanels with cross-fertilizations among them. In the first segment, I'll engage with experts from 4 electoral commissions in Africa with deep experience in organizing and running trustworthy elections in their countries. We will explore how the challenge of trust is evolving under pressure from the rapid technological, societal, and political transformations that are being felt universally. We will then engage with a panel of thought leaders from illustrious think tanks to understand how they see the threats and opportunities that digital transformations bring to inclusion, transparency, privacy, and to the fairness of the democratic process. We will then feature 2 visionaries who will share their perspectives as to how the industry is innovating to help electoral commissions reinforce trust and resiliency. This is definitely going to be another impactful and cannot miss LiveCast. I hope you will be able to join us live for this session. So please mark your calendar early. Registration is now open through the link in the chat. Please continue to be part of our community and help the movement disseminate high quality and unbiased content that can inform policy in Africa and elsewhere in the world. You can do this by being active in the live sessions and by sharing, liking, commenting, and subscribing to what we are producing together as digital public content that we make available on our YouTube channel. As always, please remember, live audience can join in several ways. You have the chat, you have the live polling, you have the Q&A, and you have the community voices. All are integrated into the Zoom platform. Just keep an eye on all those opportunities as they arise. And as attendee, you have the opportunity to request the transcript of the chat, which contains intense engagements from the community in addition to digital goodies. Please see the chat on Zoom for details. Back to today's episode. As you may recall in part 2 of this series, I explained that COVID passport rollout in Africa get complicated, not because there is a challenge in issuing a credential. The technology exists and is widely used in Africa for securing credentials in digital and physical forms. As we have seen in part 2, and we will see some more today, there are ample options that are affordable and can be deployed in Africa for this purpose. But as we will explain in the first segment today, an important challenge revolves around the chain of trust and the traceability of the test or vaccine attestations contained in the credential to a genuine clinical event, a jab administered following a vaccination protocol, or a test conducted per international standards at an accredited laboratory. Here, questions arise as to the capacity of such laboratories and their existence on the continent. In this regard, we have some good and bad news to share. And we have to thank the WHO for having focused on this issue prior to the COVID-19 pandemic in Africa. As it turns out, because of HIV and TB, there is a non-negligible capacity of laboratories that can work on nucleic acid testing, such as PCR. This is the good news. Prior to the pandemic, WHO started promoting a program called SLIPTA, or Stepwise Laboratory Quality Improvement Process towards accreditation, in an attempt to bring standardization and trust into laboratory procedures. The data reveals some interesting things. So let's take a look at the data. Here, what you're seeing is basically 412 laboratories from 27 countries that were audited and assigned star rating. Star 0 to 5. 5 means 5-star. Think of it as 5-star accommodation. It's the top of the line, best capabilities. They've got all the elements that they need. Unfortunately, you could see the 4 and the 5 stars are not exactly filling the screen. We have got long ways to go, and these are only 27 countries. Okay, but in fact, the results show something even more when you take these labs and put them up for accreditation following an ISO standard. So let's look at the second slide in that regard. Here, the story becomes very sparse. Only 78 got accredited subject to ISO standards from 12 countries. Okay, so what does this mean? This means only 78 laboratories in Africa are accredited to international ISO standards. This is the bad news. What is the implication of this when destination countries begin to demand that travelers from African continent provide test results from laboratories that have been ISO certified and accredited? Will 78 laboratories be enough to cover the needs of traveling African public? Remember, many countries are beginning to push for lab results within 48 hours instead of 72 from travel time, which makes the need for capacity in Africa more pressing. This is why we're using this forum to raise the alarm. In the rush to focus on issuing credentials, we should not forget about the need to build up the accredited laboratory capacity so that trust can be assured right from the start and credentials could be issued to a meaningful clinical event. We will come back to this issue during our session today. But let me wrap up this point by saying if we fail to do this, it is inevitable that the use of COVID credentials will lead to the isolation of the African continent, which would have a major negative impact on the development agenda. In order to holistically examine the challenges surrounding COVID credentialing, we have structured today's episode somewhat differently from the previous ones to allow for more interactions, at least for the first hour. Let us examine the structure of the session, which will consist of 3 segments. Today's session will be conducted according to the following map. We'll have the first segment, we'll be talking to 4 CEOs on a CEO roundtable. We're going to build on the wealth of knowledge that we gained from episode 1 and 2 in this trilogy and leverage their expertise and decision-making skills to arrive at a consensus framework for guiding the discussion around harmonization, standardization, and differentiation. This will be a holistic and surgical analysis of the process of credentialing for COVID status end to end. At the minimum, we want to make sense of the large number of uncoordinated efforts in the COVID credentialing world and highlight the assumptions upon which they are built, so we can better understand their impact and assess their realism and implementability. In the second segment, we will explore the European Green Pass as a top-down model for regional harmonization. Then in the third segment, we look at how some innovators are repurposing proven technologies such as live graphs, fintechs, holograms, and touchless technologies to deliver differentiated approaches within this domain. Now I'd like to welcome and thank the participants on today's panel. With us today, and in no particular order, Chris Justice from Block BioScience, UK, Adriaan Kruger from nuvoteQ, South Africa, Rafi Kaminer from Pangea, Israel, Gary Parish from HD Barcode, USA, Geert Peters from Zetes, Belgium, Pavlina Navratilova from Idemia, France, Rob Lubeck from BurstIQ, USA, Mitchell de Jong from Spin, Norway, Ilja Hofmann from OVD Kinegram, Switzerland, Hilda Karashani Louisa Petra from Mulbauer, Germany. Thank you for taking the time and for working with us and for embracing today's non-traditional format. We really appreciate it. Sincere thanks also go to our development partners, the Bill and Melinda Gates Foundation and the Omidyar Network, for their support in making the LiveCast possible and for keeping them commercial free. I emphasize, no financial or other consideration was received from anyone appearing in the LiveCast today. Their presence on the panel is due to their merit and pertinence to the topic at hand. Keeping with the tradition of this series, I'd like to start the session with a quick level-setting poll. Operator, launch the poll. Last week, we did a poll actually to see how vaccination rates were growing within our community. Not enough time has passed to create statistically significant change. So we're asking a different and a more insightful question today to kick off our session. So please tell us, what is your COVID vaccine status? Already vaccinated, likely to get vaccinated in the next 60 days, I refuse to get vaccinated, and not sure when I'll be vaccinated. Okay. Okay, the pattern is clear. Operator, 70% reported. So let me share with you the results. I think we are going to put up the slide for those who are on YouTube. Already vaccinated is 44%. That's pretty significant. Likely to get vaccinated is 21%. So we're basically going to be reaching in the upper 60s. Right, we're going to reach the upper 60s. For those who have been vaccinated or will be vaccinated in the next 2 months. I refuse to be vaccinated, 2% of our community, and then not sure. So we still have some ways to go, even within our community, for building a more normal environment. We will watch these results, by the way, as we assess our ability to reopen the annual meetings in physical form. Operator, and now I'd like to only keep on the panel the 4 CEOs and ask the others to stand by for their own segment. Okay, so I've got with me today 4 CEOs who have had companies involved in different domains prior to COVID, who are now able to bring to the table some value, added value, based on their expertise, the competencies of their companies, and also based on, they're going to help me today based on their decision-making skills to try to help dissect the process of end-to-end vaccination and issuance of credentials. So greetings, colleagues, and thank you for being with us. I'd like to start this session by having each one of you just say a few words about what your company did, what business your company was involved in prior to the COVID pandemic. Maybe we start with you, Rafi.
Hi, everyone, and thank you, Joseph, for your kind introduction. My name is Kaminer, and as CEO of Pangea, I'm very pleased to join such an impressive panel of speakers, especially at such a prestigious event as ID4Africa. We are part of ID4Africa for many years, and Pangea has been active in digital transformation business for the last 25 years, more than 25 years, and we have implemented many large-scale national digital identity solutions across Africa. We fully understand the challenges facing African countries, and I invite you to visit our corporate website, which showcases our full portfolio of digital transformation solutions. Many of you probably already know Israel is currently in the international spotlight in a positive way, mainly because of our successful getting back to normal Green Pass vaccination program. Today, I will be sharing with you our on-the-ground experience that we have acquired over the past 12 months, working closely with the Israel Ministry of Health and Israel Airport Authority.
We'll come back to that, Rafi. We'll come back to that. Thank you. Yeah. Adriaan.
Yes, good morning and good afternoon, good evening, everyone. Thanks, Dr. Atick, for a wonderful privilege. So I am a co-founder and the CEO of a company called nuvoteQ. We're a software company based here in South Africa. We also have locations in Brazil and in India, and we really specialize more in the clinical research space of digitization. Our platforms are being used in many different African countries to actually run clinical trials, and we've been very fortunate to be part of some COVID research, but we'll get to that in a little bit more detail later.
Yeah, okay. Actually, Gary?
Yes, good morning and good afternoon and good evening from the Space Coast in Florida. Thank you, Joseph, for allowing us to be here. HD Barcode is a barcode company that provides we look at it as the most advanced 2D barcode in the world, whereas we can embed over 700 kilobytes of data. We've been working with the law enforcement on products like our HD Code Blue to put their medical and emergency contact information in the code. Companies with biometrics, documents, and collectibles. We're able to put photos, like I say, biometric information in the code itself. And we look forward to talking to everyone about this afternoon.
Thank you, Gary. And then Chris.
Hello, everyone. I'm Chris Justice. I'm president and co-founder of Block BioScience. I've been a tech entrepreneur for about 30 years, 25 years in Asia, and the last 5 years in London. Very pleased to be part of today's program at ID4Africa. Joseph's question was, what were we doing before COVID? Block BioScience was actually formed by Block Solutions early last year. And Block Solutions develops blockchain and distributed ledger technology solutions for financial services. Prior to COVID, we were building payment rails and a global KYC platform to connect emerging central bank digital coin, Libra, Facebook's Libra, and other digital assets to traditional banking platforms, and developing blockchain and DLT solutions that use low Earth observation satellite data to restore trust and immutable transparency for environmental projects and carbon credit markets. Projects such as tracking plastics in the ocean, tracking deforestation and reforestation, and among others, and linking insurance underwriting markets to Earth observation satellite data to enable lower cost, more affordable catastrophe insurance for things like hurricane damage, floods, fires, etc.
Thank you. Thank you, Chris. As you could see from the panel of CEOs, the four of them, two of them represent type of technologies and activities that would have been traditionally core to the identity community, global identity community, while two others have now come into our domain, and we are now building a broader community where some of what used to be outside our domain because of the health concerns and the fact that health and identity need to be coordinated and harmonized and integrated, we are welcoming new people and new innovations in this. I'm hoping for a cross-fertilization. So let's continue this warm-up questions first. The second warm-up question, I'm going to go back to Rafi, And just briefly explain, Rafi, what does your company bring to the COVID table, like to this situation? Do you bring in technology? Do you bring in solutions? Do you bring in expertise? And the question will be applicable to all of you the same way afterwards. So just give us an idea, Rafi. You're unmute.
Better now.
Yes.
Pangea brings a full green pass solution to countries. We start from registration and going and putting in encrypted QR codes. We embed two-level security data encryption to ensure authenticity and to safeguard personal privacy. Other than putting out the actual credential, we have a PKI that we developed on our own to support the access control on devices. So we do end-to-end, basically, from beginning as registering for the vaccination, creating the database, creating the card or application, and to put the access control device at places like theaters, like shopping malls, other places here in Israel that are open now. And the usage of that in order to make sure that people that are around you are either vaccinated or tested. So in Israel, it's both ends. In addition to our, sorry?
1 second. How do you deploy these solutions? I mean, who are your customers? You've got a solution. I mean, are you selling it to the private sector or are you selling it to the government?
Both. If we look at the vaccination certificate, it's of course the government. The Ministry of Health is the one that is controlling and the one that put the RFI and the one that is getting the technology from us. On the end result, you see the theater owners and the shopping malls and other stores that are buying the access control devices with our PKI so that the key, so that they can use basically those devices in order to allow people to go in and to make sure that people around us are vaccinated or again tested. So both ends are working.
Yeah, hold on to this thought.
Yeah.
Yeah, wrap up, Rafi, so we can.
Yeah, wrapping up. The other part that we are doing is that we are working with the WHO, with the Vaccination Card Initiative. We're an active technical partner with the WHO for the Green Passport, which is the international part. The other part that I spoke about was more on the local part. And this initiative will enable international travel, which is, I believe, one of the most important parts in the next stage or next focus of COVID-19.
Okay, thanks. We're going to continue the discussion. Adriaan, what did you bring into the table?
Yes, I think from my side, obviously being from an African country, although I think we're quite fortunate in South Africa with a lot of the infrastructure we have, I think we're not bringing a solution, but more experience and expertise working in the different African countries, in rural areas where we do clinical trials and clinical research in different disease areas, HIV, malaria, TB, and also COVID. I think it would be good to share some of our experiences with all the people on the panel today. And I know a lot of them have also experienced with all the difficulties we face from an infrastructure perspective in Africa. But it's merely from that perspective, and also where the vaccines are administered and also where the tests are conducted. We've seen obviously the state-of-the-art facilities, but we also know how it goes in some of the other places.
Right. I'm going to come back to you and we'll discuss when we start our collaborative discussion on the sort of the digitization of the lab processes, which is going to be required and how you see that evolving in Africa. Okay, Gary?
Yes, well, HD Barcode brings to the table a kind of a unique application as far as tying it in the fact that we don't need the internet connectivity or even cell phone connectivity or a database. We can put all the information in the code itself, from photographs, like I said before, to biometrics. That ability, especially in Africa, can come in handy as a primary to put that information on a document, or as a secondary in case there is no internet connectivity, as there in a lot of areas. The important thing here is it can also be printed with standard desktop printers. Each manufacturer, each country can have their own authorization keys to allow only those authorized to read the code or generate the code to do so. So that makes a big difference in that you have a chain which only allows the people generating the code, as long as it stays secure, and the people reading it, both can have the surety that it is a genuine code. It brings up your photograph in color or your biometric information.
Okay, so you do have a specific solution that would work in an offline environment, which is a challenge, an open problem. So that's one area we'll be exploring next.
Yes.
Okay, thank you, Gary. And Chris?
Sure. So at Block, we took our KYC platform architecture that we were building for financial services and redirected it to provide a platform for enabling fully self-sovereign digital identity. That is also a platform to store and share personal health information of COVID vaccination status, COVID test results, symptoms, and other health information. Our belief is that individuals should have control of not only their digital identity, but also their health and vaccination information, and be free to use it as they see fit, and to be able to control its use, or as many fear, to prevent its misuse. The platform consists of 3 components: Block Pass, or SID, which stands for Self-Sovereign Identity. It's a mobile application, and Block's SID is for everyone and anyone who wants sort of the most trusted and private health wallet available today. It is the only health wallet today that is certified at the highest privacy standard by ID 2020. I don't know if everyone knows ID 2020, but it's a global NGO whose founders include Gavi, the Global Vaccine Alliance, who provide 40% of the world's vaccines and is financing the COVAX COVID Vaccination Acceleration Program to help developing countries secure and deliver more COVID vaccinations faster. Other backers of ID 2020 include Rockefeller Foundation, Accenture, the UN, and others. The second part of the platform is Block Verify, and that's the verification side. And that enables a privacy protecting method of keeping places as COVID safe as possible. Who is it designed for? Venues like sports stadiums, theaters, transportation service providers. We're very involved in developing solutions for aviation, the cruise industry, trucking, useful for any businesses that need to stay open all the time, like TV film production, critical infrastructure, large-scale construction projects, etc., and governments to give citizens a secure place to store and use their COVID health status information. And then the third element of the platform is Block Insights, and that's the web-based portal that is used to configure the protocols for accessing different spaces or uses for SID. And we really, I'll just mention the last thing, we really architected the platform to ensure to provide what we think are some of the most important considerations for health wallets, namely, and I can go into more detail later in our discussion, I think, Joseph, but trust, privacy, flexibility, interoperability, ease of use, and low cost.
Okay, great. So, I mean, it's clear that all of you come from highly qualified organizations, highly competent organizations. You come from very different perspectives, but you also have been, for the last year, just like the rest of us, have been focusing on this major problem that is challenging our global community. The problem that I see today is that we are entering into an era of highly fragmented initiatives, highly uncoordinated. We use different terminologies. We do different, in many cases, we may be having similar solutions, but the way we're presenting it is so different to each other that it creates confusion, and that confusion will create in the customer mind reticence to join these type of programs if they don't understand what the privacy and the control that they have, and therefore this could have a negative impact on the process. Okay, process of vaccination. So what I'd like to do now is I'd like to share a framework, and then with each element of the framework, we're going to have a discussion. That's the time of discussion. And then I'm going to invite the audience to participate in that discussion. So let me share a screen and let's talk about basically the vaccination and testing framework as a vital events. So basically, what do I mean by that? This should be very familiar to everybody in our community. a vital event such as birth or death happens, needs to be registered, needs to be credentialed, and needs to be used. And so in each one of these elements of the chain, there are challenges to affecting the registration and the issuance of the credentials, but also in connecting the chain of trust across from 1 to 4. So what I want to do next, I want to take one step at a time, and at each stage, examine the opportunities for harmonization, standardization, differentiation, look for gaps. What are the gaps that are out there, and what approaches and options that are available that could solve the same problem? So let us begin with this process. The vital event is the first element in this chain. So what kind of events? Remember, we're going to cover vaccination and testing. So this is not just vaccination. The ecosystem consists of the health authorities, there's clinics and labs, the suppliers, and the public. This is a big ecosystem. It's the whole society, with the health community being the driver's seat. It's regulated. It's highly regulated. They've got health protocols existing, international standard, lab accreditation, and personal licensing. So that raises some questions. So what I'm going to do now is I'm going to come back to the panel and use these questions to guide our discussion. Okay, so I want to reach out to Adriaan and maybe Chris first. The medical ecosystem that we have globally and maybe in Africa, do we believe that it is following the right standards, there's adequate standards, and those standards are actually accessible to anybody in the world? Or do we have a capacity challenge in getting to the standards? Adriaan, you must know the ecosystem in Africa. What do you think?
I think in my world, obviously we operate in a very small sort of closed world in the clinical trials industry, and our data standards are prescribed by the regulators of the different countries, and there is some harmonization there, but I think it's easy because it's a very small population. But I think from a bigger scale between different countries, adopting like a FHIR data standard, it's not something that is in place yet. Even us as South Africa, which I think is from a technology perspective quite advanced, we struggle to even follow standards just between our different private hospitals, not even on a country level. So I think there's definitely a lot of work that we need to do, but this might be a good place to start, because I think to issue a vaccination certificate, you don't need as many different elements to capture that specific entry or that event. But to digitize an entire electronic health record of someone becomes and standardize it across the continent is a little bit of a bigger task. So maybe start small, and this might be a good opportunity for one of these technology providers to assist us and all the other African countries. But I think, yeah, we're still lacking.
Right. So we're basically talking about just one event. Forget about the credential, forget about the pass. We're basically saying we are going to register the fact that somebody got vaccinated. That's the ground truth. If we don't solve that problem, then everything else that's built on it is a house of cards. I mean, Chris, what do you think? Is this an area of focus that we should be starting from?
I think absolutely it's a really important area of focus. And I do agree with Adriaan in that I think this gives us a perfect opportunity to keep it simple, to actually get something going. It doesn't involve the entirety of one's health records, but rather actually the information that's necessary to collect for a COVID vaccination is, I think as Adriaan was saying, really quite limited. There are only so many vaccination producers. You know that it's going to take 1 or 2 doses. You want the dates of those doses. You want the batch number. And then you want to be able to follow up, because as we all know, there are probably going to be required boosters at some certain intervals beyond second dose. I think that having some common standards and starting small and starting simple are really important. And there are quite a few bodies that are actively engaged in trying to set some of those standards, whether it be ID 2020 or the Good Health Pass initiative, the vaccine credentials initiative, all of the initiatives that are going Good Health Pass that around travel and restarting international travel. I think those are important. Of course, we're going to hear more about the European standard in a few minutes. I think those are all very important, but I think one of the keys is to make sure that they're all interoperable and to keep it as simple as possible. I'm looking forward to hearing from others, how we can keep it simple. I think just on the other piece was the laboratory piece. And I do think that, I mean, the way that we're looking at that issue is using the platform to connect in a privacy preserving way, the lab sample from the individual's health pass to the lab. And then the lab can then upload the result of those tests automatically without having to go back to the individual. So then the lab accreditation is very important. So most countries, not every country, but most countries have approved labs. It would be great for governments to get a little bit more involved and say, here are the 50 or so labs that we have accredited for COVID testing. Like in Taiwan, there's a list. You want to know who can do a COVID test in Taiwan? Here's a list. These are all the ones the government approves. That makes it easier for providers to go out and make sure that they've got the right APIs to link into the right laboratory information systems so that that process can be automated and therefore have a higher level of assurance or attestation.
Right. Hold off to this point. Hold off to where the data is going to go. We're going to follow the chain of the data. I'm going to assume that the WHO and the World Health, the regional health facility organizations and ministries of health have their act together. And in fact, they have established how to conduct these vaccinations, how to conduct these tests, subject to protocols. And everything is fine. And the SLIPTA program was exactly that. WHO was trying to build that. We know we need capacity improvement in Africa, but this is not my point. My point is, even with that, let me talk to Rafi and Gary, who are experts in custody, chain custody, and fraud resilience. I'm not talking about the fraud of the credential. I'm not talking about the fraud of anything else. I'm talking about the fraud that can happen at the moment of somebody was supposed to inject you with a vaccine, didn't do it, but ended up registering, and that somebody might have altered the information. There's a collusion that could happen, and there's a supply chain. Somebody could have given me something else because I didn't want to take the vaccine, but I need that document, so I just played along. Rafi, how do we, or is this something we have to live with, knowing that we can never manage the risk as affiliated with the fraud in the first step of the process, not in the rest? The rest we're going to talk about next.
Well, first things first, if a country does not have a normal ID, civil registry, it's going to be a big problem for that country to do the initial registry to get the vaccination. I'm not talking about the actual vaccination. Before you get to the point that you can get the vaccination, you need to register. You need to do a queue management. You need to let people know when to come and where to come. And for that, first of all, you need to put some information into the system. This information into the system in countries that have the electronic ID, that's the initial information. You put in your ID number. This is what you put. This is the main information that you put in. Once you put that in, you get all of the other information. When you get to the vaccination point, you already are registered over there. They know that you're going to get there at 11:45 at that date with that ID, and you get there and you get the vaccination. Then all of the chain includes all of the information, and then you have the accurate information in the system, and you move on to do the vaccination, and you can, after 2 weeks, get the green passport. The problem is, how do you deal with countries that do not have the electronic ID? They do not have a civil registry. The DRC that we work at, and the Madagascars, and the others. What do we do over there? How do you get the information in? And that is something that the countries need to prepare themselves in order to start the registration. I'm talking about registration for the vaccination, not the actual vaccination itself. So this is where we are now touching points that in those countries are the main point to start the process. And we don't have that point yet.
Yeah, but why do I need an identifier? Couldn't I just register by name and my date of birth as a claimant, just to say, these are my identifiers. I show up, I'm supposed to give them an ID. I can show them a driver's license or a passport or something, and that verifies my ID. And that, I mean, do we need to, in order to start the vaccination campaign or vaccination registration, do we need a digital ID, or can we do without a digital ID? I'd like to hear that, because that might be a question of convenience, or might be a question of necessity because of fraud or trust in the system.
So I think that you must have some sort of an ID. Otherwise, you just give a name and you move on. I mean, that's a basic thing. You cannot register without having some sort of ID. It can be a driver's license, can be a passport, it can be an electronic ID. But without anything, just walking in and registering with any name or number, it does not create any accurate database that you can take it from there and move on to the green passport.
Right, but you don't necessarily need to build the identifier inside. You can say my identifier is my name and my date of birth. And then when I get verified that this is Joseph Atick, born on this and this date, I can show an ID that verifies. That's different from saying I need a national ID number, or I need a digital ID number in addition to my name and date of birth or whatever. So the question is, what is the ID credential that is needed? Because in many countries in Africa, if we are to wait for ID to develop, we are going to end up delaying the vaccination campaign because a lot of countries don't still have it. Chris, did you want to say something?
Yeah, I would just wanted to add briefly, our solution to that issue is to, yes, you need an ID, but you don't need a centralized database. So if an individual goes to a vaccination center with their ID, if the vaccination center is running Block Pass and Block Verify, then the person who should be an accredited medical personnel providing the vaccine, I think, take that as a given. That person can look at the ID. The individual takes a selfie on the app, takes a picture of their ID card, puts in their expiration date of the ID card, and that's it. The medical personnel looks at the person, looks at the selfie on the phone, same person, looks at the physical ID, looks at the picture of the ID on the phone. Okay, all that matches. Then that medical personnel attests to the ID of that individual.
That they've been verified.
That's verified. It's a verified ID that can then be attached to that vaccination.
Okay. Well, let us hear what the audience thinks. Let's run a poll. Do we really need an ID or date of birth and name is enough to manage the vaccination? Join us in this, please. Just a quick poll. Do we need an ID or date of birth and name is enough for vaccination credentials?
That as well.
Excuse me?
I just want to add a few points to this.
Yes. Go ahead. While the poll is going, please go ahead.
Sure. Within our code, since it's a private, not a public code, we can set up each agency or each lab or each in the states, they've got it down to supermarkets. So distribution to the distribution chain is unique in itself. And then we can set each one with their own key. You can actually put in who gave the test, when they gave it. And as long as you provide a adequate ID, we can put the photograph of the person in the code. So all that can then go to the person and hand it to them. Don't need a database. And it stays with the individual, it stays private. All you want to be able to do is say this person, and I can absolutely prove this person was vaccinated by a legitimate agency. That's the way we kind of look at it.
Okay, hold on to that thought. Operator, end the poll. So it's interesting. It's about 40% said yes, it's enough to have date of birth and name, and 60% no, we need a better identifier. So even within an identity community, we can see not everybody believes that you need to go beyond the name and date of birth. Okay, so we have an issue here. We need to figure out how to manage the identification aspect of the vaccination process. And then one other issue was raised by Gary and by Chris, which is where would this data go? The fact that you are tested that this person has been vaccinated. So bear with me. Let me go to the next phase of this. And let's follow the discussion. Here we sort of laid the ground, and now we're going to take it one step forward. The one step forward is the next phase. So what's the next phase? The next phase, you've got registration. And in there, I don't see how the lab cannot have a local registry. They're sitting on a computer. They have to put on the local registry some information. The question becomes, will that become part of a central registry, consolidated data or not? And then what other services you are going to need to put in place in order to turn that registry information through a service gateway to a certification, through attestation, notarization. Okay, so this is the framework that we're going to discuss. That raises lots of questions. So putting those questions on the screen, I'm going to come back to the panel and let's see how we can establish consensus, or we have a challenge. So somebody got vaccinated, somebody got tested. Where does the data flow start from then on? Anybody on the panel? Where does this data go?
It should go, sorry, go ahead.
Go ahead.
Great. From my standpoint, it doesn't have to go anywhere. You can stay with the individual, and all that data is in the code. So it's a vaccination, not a passport.
Right, but what's the problem? What is the problem with it going to a registry? Given that, what if they lose their phone or their whatever and they cannot prove their vaccination? What is the problem? Actually, I would love to hear from the audience whether they think you need a registry or you don't need a registry. Gary, you're saying no, you should just give it to them.
Well, you can do it both ways. And the problem comes in when you register, and I just saw something here in the States that some of these commercial people are going to use that to market. Once you got you registered in the system, they use that as a marketing tool as well to say, okay, I know this person now, I can make him a customer. Or that information now becomes into a central database. Can you? Yes. And maybe in some respects, it's okay to do that. Is it absolutely necessary? No.
I mean, also from an auditing point of view, don't you need the laboratories to show the government that these are the people that received? I mean, if we don't have a registry of people that have been
you need all their information. You can give their name and an ID number for the test. You need all that data with them. Right,
but you're raising the question of the data model. So that's a good discussion to have. Why do I need more than just the fact that their identifier, the name, date of birth, or if you want an optional national ID number, but I don't need more than that. And then the information related to the vaccine itself that they received and the date, right?
Right.
Yeah, the medical information of the vaccine itself, for the production, and ID number and the name is enough.
Right. So we agree that there is a model which is pushed for by the WHO. We've got a WHO model. We should all follow it. We should all minimize the data to the level that is specified by the WHO. We follow it. And then the question becomes, we have to insist that the labs are accredited. That's outside our control. But once the lab is accredited, we have to have the software platforms that allow them to establish registries that show us all the people that have been registered. That becomes, to me, the ground truth.
Absolutely.
I think from our perspective, in our framework, you asked where does the data go? In our framework, the data stays with the individual on their phone. There is a backup, a guardianship model, so that there's a backup of that, but there is no need to have a centralized database. And in fact, when we started architecting this, we started from the position of, well, this may be a great idea, a great place for blockchain. And there are a lot of solutions out there that do use blockchain in the solutions. We felt that the best way to preserve privacy and make that information useful was not to have a centralized database, but rather just to have all of that information on a phone. And I think with Gary's QR code, where you can embed with a photo, a selfie is a pretty good identifier. If you've got something that matches that selfie with the vaccine record or the test record, then you have both an online, a digital and a non-digital way of verification.
Yeah, but the rationale to have a central database goes to the place where a country wants to understand who received how many, what kind of doses, if it's a Pfizer or if it's a Moderna. If there is a problem with a specific production of Pfizer, you want to know who received that and to go after them and to make sure that you can take care of them. You have to have a central database. It cannot be only on your phone. Then if you have it on a central database, then you can analyze your country situation, you understand what to do with it, and then to move on with any operation that you want to do for a specific people.
Rafi, hold on 1 second. I think we are getting a point where I need a lifeline. So anybody from the audience wants to step up and join the conversation regarding whether we need a centralized registry or no centralized registry. It seems to me with data minimization, that you still need to have a registry, because at the end of the day, the attestation, you're trying to combine everything in once, which is the laboratory is the one issuing the pass. We're trying to say that would be really unfortunate because there is important steps that have to come in between. The labs should only do the vaccination and record the vaccination. From then on, there are other authorities that will attest. They may have an API that comes in and allows them to attest. Okay, bring whoever raised their hands. I don't know who they are, but please be pertinent to this question. Do we need a central database or no central database, meaning registry or no registry? Because there are solutions which are highly privacy protecting. You can put it in the code, or you put it in the device, you can have it under your control. But now you've combined the registration, credentialing, and the pass generation all at once, which may make the problem of basically interoperability harder, because now you made it so proprietary. Now we're looking at the standard just for registration. So bring in some people. Stephen, operator, bring in others as well.
I'll just make this comment, Joseph and panelists. First off, it's a very interesting conversation. People are mobile. They don't stay in one place in any country. They go from county to county, state to state within the country. And you can't restrict them. I'm in a different place. I need a vaccination, or a pandemic breaks out. I need healthcare. They need to be recognized wherever they go. And they need to be recognized in a secure, permanent point of view. Their identity needs to be biometric. I'm biased. I'm a biometric guy, but their identity needs to be confirmed by biometrics. And confirmation of identity is best when it's multimodal biometrics. But the mobility of people just drives us to a central registry. I'll stop, Joseph, and let your next panelist take place.
I heard what you say. The challenge with that is that making it simple, which what the panelists have said, adding biometrics at this stage in time, where all you wanted to do is basically set laboratories that are testing that this person, name of that name and that date of birth, got vaccinated or got a test, would add a layer of a lack of interoperability, because then we're going to have to ask, how do you identify people biometrically? We know there's no standards for face. We know there is no standards that we would be acceptable to a country in Africa as it would be acceptable to a country in Europe, as it would be acceptable to a country in the United States. So well phrased issue, but I'm not sure we are in a position to say biometrics at this stage. It should be injected at some point, maybe at the past generation, but not necessarily at the registration point. But I'm willing to hear other opinions. Actually, Carl, let's just get your view.
Yes, good afternoon, and thank you for giving me the floor. I think as far as the individuals are concerned, it's sufficient if they have a valid passport and the data on that passport, and that is linked to a database of certified laboratories or GPs who are accredited to give those vaccinations. I think everything else will be a global mega database which will not work and is over ambitious, and in practice, will not work. Thank you.
Would you be willing to let the laboratories maintain their local registry of the vaccines that they've offered or the tests that they've offered, because they have information system? Would you be willing to let them do that?
Yes, of course, if it is auditable, if it can be audited, because obviously a laboratory should have the interest that the accreditation is not withdrawn. And therefore, I would assume that a laboratory would put in place the internal controls so as to vaccinate properly.
Right. So, okay, great. So now, actually, Rafi, Israel does maintain a consolidated national database of those who've been. It does, and that's the source. That's the source from which you derive your truth.
Yes.
And there's
absolutely.
an API.
With the information in the central database in the Israeli Ministry of Health, which comes from the HMOs. HMOs are the ones responsible to do the vaccination in Israel. Over 90% of people over 60 years old have already been vaccinated, and over 70% of the total population over the age of 16 have been vaccinated. All of this is going into one central database, and the information that we receive in order to create the green pass comes from the Ministry of Health. Okay,
great. I want everybody to stay on because this discussion, even the people who joined the community voices, but let me advance the slide one more time, because I think we're getting into a discussion that will cover that. So let me put this on, and then I'm going to give you the chance to raise your opinions about this. Okay, we talked about some of the problems that can emerge when you mix everything together. When you mix the registration, then you mix the registration, certification, and use. And so here, I'd like the panelists and our guests from the community voices to distinguish the difference between credential and the pass itself. A pass authorizes you to do something. A credential just attests that you were vaccinated or you were tested. So I'd like to put these things on the screen and make them available for discussion for the whole group. So let us, instead of me going over them, I'd like to talk about some of these issues. Now, we have not given anybody the opportunity to speak. Harm, come up and give me your perspective about the question of data.
Thank you so much. And I think this is a timely discussion as well, since we are looking at different initiatives at different page in different regions and cultures. So I'm living in the Netherlands. I've been following the Netherlands, of course, and also the European Commission with the digital green certificates, but also I'm supporting the Good Health Pass initiative because I believe in global interoperability. And there's a fine distinction between the credential and the pass that is important here. So instead of having a minimum and at the same time maximum data set, what is important to understand is that there need to be a more fine-grained level of privacy filter. And for that, you need a global trust framework. You need to have a kind of a registration of labs that can issue or do tests that have been accredited. Without that, there will be no trust in any kind of paper or digital certificate. But the good understanding here is that a pass is really, for instance, can I get access to an event, or can I get access to the stadium? Instead of showing your whole burst and health data, that is important to have a broader ecosystem view and a more end-to-end trust in this.
Explain to me, do you think we can live in a world without registries of vaccinated people, whether they are distributed registries, state level, then they consolidate? We need a ground truth. Do you think we can live without that, so that I just got it and then there's nobody has any evidence that I got registered as a vaccinated person?
No, you need keys, you need distribution, you need to have those keys registered with a trust
Right. So, and for us to issue credentials, etc. I wanna reach out to somebody who's really being active and invite him to come up to the screen. Stephen Wilson, this is a call out to you. Come up to the panel. You've had a perspective about this. Please, if you're able to turn on your video, come up and talk to us about it. In the meantime, there you are. So, Stephen.
Yeah, Joseph, thank you. Great to see you again. Look, I
speak louder.
My microphone. Thank you, Joseph. It's great to be here. Thanks for the opportunity. I have been working in this area for a while. I want to ask with great respect whether this community of people right now includes healthcare providers, because the idea that we must have a digital identity in order to manage vaccination, I think must be wrong. I am familiar with healthcare. I do not know a single nurse in the world who would refuse to vaccinate a thin file person because they don't carry a digital ID. So we need to be quite clear that there is a registry of vaccination, and I think that is situation normal. I think public health authorities the world over have vaccination registries, and I think that that's normal. The idea that we must have a digital identity record to support vaccination, I think, is coming from a technology side of the house. And I have to appeal to the WHO interim guidelines for smart vaccination certificates, which says very, very clearly, let's not use any new exotic technology. Let's use an established technology such as PIC-AI for the trust network. But above all, a more important point that they make, which is a policy point, and it says you must use the identification processes and norms, they use the word norms, that operate country by country in public health authorities. So I say with respect that this conversation is dominated by a particular technology paradigm, which is trying to force self-sovereign identity on people that don't need it. I don't know what the advantage is of person owning an identity in this context. I get it everywhere else, but for vaccinations, I'd like to ask, what is the advantage of self-sovereign identity in this context?
Yeah, I mean, Stephen, I think what by doing this exercise, what I've been trying to do is move away from the need to innovate across all the board of the chain. You want to innovate, you can innovate at the pass level. You can have programs like IATA Pass. They may require me to integrate it more tightly with my passport. There could be passes for clubs where they can integrate and do that. But when we want to talk about something as fundamental as registering my birth or registering my vaccination, I believe we need to get as basic as we can get and not innovate in that area, because in a way, by innovating, we may become not interoperable. We may allow the innovation to drive the discussion when, in fact, I mean, look at Israel. Israel did it, Egypt did it, and they basically said, this is the first stage. We gotta record people. Somebody shows up, they show me their name and date of birth. That to me is an identity. If you want to link it and innovate at some other level, you can do that, but it doesn't happen at the start. Identity should not be the driver of this. At least this is our view. This is the view of ID for Africa. And even though 60% of the community believes that we need a better identifier, I plead to say that there might be a confusion. I think they think that identity can come in and make the convenience aspect of it. Because if I have my pass, I'll tell you the Excelsior pass. I show it. Somebody asks me, show me your ID. So I now show the pass and show my ID. Integrating the two can be much more convenient for the crowds that are going to be coming into Broadway, into facilities, so that you don't slow down the flow. I have no problem with that. In that case, I would create a strong ID linkage. But in the beginning, it would disturb me to be told you should bring in your passport or whatever, or something.
Joseph, I beg to differ.
Please.
When you are registering someone for vaccination, it is the beginning of a process. The country wants to know that you, Joseph, was vaccinated on that date, and in 6 months or 9 months, and nobody currently knows when you will need to get the next vaccination. This is the way for the Ministry of Health to basically know all of its people, when were they vaccinated, when should we send them a new, when should we prepare for the next vaccination? How many are going to be vaccinated on a specific date? You cannot manage a Ministry of Health without knowing this information. Therefore,
my name and date of birth
comes from the ID. So that's not enough.
Why?
Your name and ID. How do I get send you an SMS? How do I get you the information that you need to get the next vaccination? How do I get you to let you know that the what you were vaccinated is problematic, that there were problems with the specific vaccination that you received? How does a country manage that?
Well, similarly as they issue through the media to say, you know, if you've been vaccinated certain date, you gotta go and get revaccinated or something like that. But for them to take my phone number and have the ability to localize me and connect me, I feel uncomfortable. I don't know what the panel believes. The panel believes that I sort of believe in a minimalist approach, which is what the WHO has said. You get name and date of birth. That's the identifier. But Rafi, you're not concerned that now you're building a non-minimal set. Let me hear from anybody else from the audience.
It's a vaccination. It's a medical thing. It's nothing to do with your information being out. It's a medical thing. If they need to get a hold of you immediately, they will not put it in the newspaper. They want to get a hold of you today because you got yesterday a vaccination that might hurt you.
And so you think that we need to have the phone number as required, and so
the phone number, email, something that your address, something you need to have some information so that so that the Ministry of Health can get to you if there is a problem.
Okay.
I wonder if these are two different questions.
Go ahead.
I wonder if these are two different questions. That is, Ministry of Health has information that they need for all the reasons that Rafi mentions, right? But for a health pass or for the individual to be able to make use of their vaccination status, I mean, ideally, they don't have to give any of that information.
Yeah.
If you have a platform that can just be able to notify them without having any of that, other than an obfuscated UUID on their mobile device. Because you can do it that way, and that's the way. We built it so that we wouldn't. In fact, we don't take a person's name even. We just use their mobile phone, and so it can be done.
So
with very basic technology, we don't use blockchain anywhere. It's just basic iOS and Android operating system. It's just a way of just designing the interactions that the verified side only asks, does this person meet these criteria? And they query the evidence on the individual's phone, and it's a yes or a no.
Yeah. Let's talk very quickly because we're clearly way over time. But let's talk quickly on the question of how, we've registered people we all seem to be gravitating towards the fact that there has to be a ground truth somewhere. And that ground truth is going to say and be interrogated to say, did this person get vaccinated or not? And it's going to come back with the answer, yes, no, there's data minimization, etc. And then based on that, other passes can be generated. For example, I want to talk about the IATA pass, with the idea that IATA could establish a relationship with the Ministry of Health of a country or with the state health authorities like New York State, and basically say, I sign up for IATA, and IATA says, can somebody attest for you that you have been vaccinated? I give them the URL, they go in, they ping with my name and date of birth. The state sends back saying, yes, this person has been vaccinated. And now I went from an attestation gateway to a pass that's called the IATA pass, which will allow me to fly. So in that model, there is a chain of trust that was not broken because I am not providing them with any material that could be faked. Chris, you would say they could have given me a certificate, and then I could have given it to IATA, and IATA could have verified the authenticity of that certificate. Would you say that that's the approach you would take?
Certainly the ideal scenario is for governments to be, or national health departments to be able to say, yes, this person has been vaccinated, and they provide that information back. But if we wait to do that, the pandemic will be over. And it may be very easy for some countries like Israel, maybe the UK, where I live, where you have a reasonably well organized national health system. But in the US, you have to go to each state, and in Africa and where you don't, or Latin America, we're pretty active. They don't have great centralized databases and registries. Ideally, they have it and it's secure for health use. And then the block passes, the IATA passes, the commons passes, they all could query that information on an as needed basis. But the individual needs it as well for their own uses. And so I think they're two separate, in many ways, I think they're two separate use cases.
Yeah, but Chris, if we reorient ourselves from the notion that whose responsibility to provide the attestation, in a way, I have been vaccinated by the New York State, and New York State is willing to give attestation to that fact. They're not willing to do anything else. They're just going to attest. So when I try to join a PASS program, the PASS programs need to have a mechanism that says who can attest for you. Agreed. And I bring that attestation. I could have a certificate, but there's a PKI that's sure. Securing it, or I could have an API by saying, well, check Joseph Atick and date of birth. The state of New York attests for me. I don't need the United States to be all involved. I just need some state at some point that can attest for an event. That's why thinking about this as a event, such as the birth registration, where we attest to it that this has happened, and decouple it from the past generation, even from the credential generation, will create a better standardization, because the states can just go ahead, issue these attestations when people ask you to do it. Yeah. The states shouldn't be involved in the past business.
No, I agree. And as long as there's an open API for that information, and the state validates that this path meets certain privacy standards that allow that path to be able to query this database or information, then fine. And as long as the individual is the one who is consenting and requesting that.
Right, exactly. They give permission, and that's exactly right. Adriaan, does the government of South Africa maintain a registry? I mean, you have a wonderful civil registration system and vital event registration. Are they implementing the same platform to register the vaccination?
Yes, so we have to link it either to your national identity number or your passport number, and we also make provision for refugees. They are issued with the refugee unique number when they enter the country. But I think hearing about all these things, Africa is different. So I really think having stuff only on a mobile device is not going to work. No. Paper is really, a hard copy is essential. I think we also have to approach it in different ways, because air travel that includes 0.01% of Africa, like normal cross-border travel, road travel, that is where the rubber is going to hit the road, literally. But we've got a nice system. Once again, there's a problem with connectivity, because to able to register, to get in the queue, so that you have a time slot of when you can go for your vaccine, is only available electronically via a web platform. And even though the majority of people in African countries have smartphones and mobile devices, they don't have access to the funds and the means to access web platforms. Right. So you have to either zero rate these things, or there's all kinds of different things. They also don't have accounts to get to the iStore or to the Android marketplace. So it's yes.
Yeah, so it's an ecosystem which has to work within the traditional paper-based. Now, Gary, in the traditional paper-based, how would that work? Because offline is a big problem, but it's offline for the credential itself, but also maybe offline for the verifying device itself. And what do you think about the possibility of this double offline being realistically available on piece of paper, but also a device that does not connect to the internet, verifying it?
We don't have a problem with that since, as I guess I mentioned, one professor said, we're a memory stick on paper, so over 700 kilobytes. So we can put all that data and get printed on a standard printer and hand it back just like a QR code, but it's a private code. My concern, and I see a lot of the different applications use a QR code, and it scares me because anybody can make it public, and you want something that can be secure, whether it's our system or somebody else's. So if you're going to authenticate someone, you can put that on paper. You don't need the phone, you don't need connectivity, you don't need the database. The hospital or the laboratory or who's ever using that can store the data. And what we do for law enforcement is once the code is created, we actually destroy the information from the database. They could save it if they want to, and what they want to put in it becomes optional. So we don't force that information, but as long as you can authenticate by photograph or biometrics or some way to say, even matching it to a driver's license number, you could do that all offline.
Yeah, I understand the binding. The problem that I find is that we can't have everything at the same time. Meaning, if we want interoperability and openness, then we won't be able to use these type of coding. If we want an end-to-end closed system that works within an ecosystem, then that's fine. But the readers and the generators would have to be specific to your technology for them to be usable.
We use an iPhone or Samsung or any of the phones with a camera with just like 5 megapixels.
Right, but you would have to have your software, not any reader.
But see, once you go public, that means anybody, whether it's creating a code or creating reading devices or sending it to a phishing site, it becomes an issue.
Okay. Sorry, Steve Wilson is asking, Gary, a QR code can be digitally signed by the credential issuer for security and tamper resistance, copy resistance harder for paper-based QR codes, yes?
Yeah, you can do all that, but what if I create what does the user know, or the person reading the code, the difference what a good QR code looks like and one that I create that sends you to a bad site? You don't know the difference, and it's just like any counterfeiting tool. And that's the problem. Okay.
Unfortunately, as I expected, we've raised a lot of issues. This was an interesting session, but a quick session. We're out of time. I want to move on to the next panel. I want to thank the panelists for the first segment. We will come back to you another day to continue to see the progress, maybe in the fall. Operator, just give me another poll, and let's see to end this session with. Thank you, gentlemen. Operator, launch the second poll. This is a little bit of a thorny subject, and we've been asked this question a lot, which has to do with the ethics of using these COVID vaccination, not testing, COVID vaccination. Do you think it's ethical to ask people to show a COVID pass when they apply for employment or seek employment? So there's one question there. And then the second question is what's happening in the US and some places around the world. Is it ethical to require proof of COVID vaccination for attending universities? So please vote. Please vote, and let's see where that comes up. Continue to vote while the operator will be bringing in the second panel. Okay. I think it's stable now. Operator, end the poll and put up the results. Okay, so 61% of you thinks it's ethical to require a COVID vaccination certificate for employment. And then also university, 57% of you believe it is ethical to ask for COVID. So we're back again in the 60-40. Operator, put up the slide for those who are on YouTube. Okay, so here you go, 60-40, almost 60-40. People strongly believe we're anxious to reopen the world, and therefore when you are in touch with others, such as in an employment involving public contact or a university where you're surrounded by a lot of people, believe you should be vaccinated. Okay, that's insightful. We are going to now move forward. And I'll start with you, Geert. Both of you, Geert and Pavlina, thank you for being with us. You both represent companies who are in Europe. You must be aware of the Green Pass, the European Green Pass, and how what implications it has, and what is its strengths and weaknesses. So I would like to put what you are doing in that context. So Geert, why don't you start us off with what you're doing in this area?
Thank you, Dr. Atick, and it is an honor to be part of this session of today. So my name is Geert Peters, working for a company, Zetes, which is in fact a leader in identification. Allow me to share my screen, and I have a small presentation that I want to use to at least highlight some points that I want to present. There you go. Can you confirm my screen is visible?
Yes, it is.
Okay. So the Green Digital Certificate is an initiative by the European Commission, which will allow the citizens of Europe to resume traveling. It is the main goal of it within the European inner borders. And as such, the aim is to reboost the European economy, not only in everything to do with cross-border labor, but also everything to do with tourism. This initiative has been declared in the form of a regulation, which means that it's a kind of a European law which will take immediate effect when it will be voted. It contains a technological and a trust framework, and in that way, all European member states will need to comply to it. One can therefore easily imagine that many international eyes are currently geared towards this Digital Green Certificate initiative to see how it will lead to harmonization of the health status of the European citizens and how it will be re-establishing the free travel, free movement of people, in fact, one of the founding principles of Europe. And given the travel restrictions that were set during the past year, there is a strong desire to re-establish this as soon as possible. There's even a deadline set to have it operational by this July, which is in fact the European summer period. The Digital Green Certificate also takes into consideration other aspects, key aspects, such as data privacy, but also inclusivity. The latter, in fact, means that the solution has to be accessible also for those people not in possession of a smartphone, and that there should also be a paper or a physical version exist of it. But, and also maybe even more importantly, it also means that there should be, and the Digital Green Certificate should also allow the possibility to travel for those that are not yet vaccinated, or even that for those that will not want to get vaccinated. And therefore, the Digital Green Certificate needs to be seen as a kind of proof of health, and definitely not as a kind of passport or pass which dictates some obligation. In that sense, the Digital Green Certificate is also a bit broader, and it doesn't only contains the vaccination information, but it also contains information about a possible COVID-19 test, or even information about recovery when somebody has been infected with the COVID-19 virus. In that sense, the European initiative is of course desirable and even necessary, and in many aspects it will provide an answer to some of the preoccupation that will come with the implementation of such a health pass. However, if we extend the scope and we try to put it in a broader perspective, we can see some weaker links that are attached to the vaccination value chain, and they need or should be made stronger. Allow me to go to the next part here, which is the vaccination value chain. And if you look at it, you can see that the proof of vaccinations, of which the Digital Green Certificate of Europe and other initiatives that have been explained today and in previous sessions, that there is a very strong link between the logistics in the delivery of the vaccines. And this is the part that you will find on the left-hand side of the screen. In that sense, governments needs to ensure that there is availability of vaccines for their citizens. They will need to find transport and storage solutions to get the vaccines to the vaccination centers, which are sometimes maybe even less accessible or in remote places. And in that sense, they also should ensure the cold chain that is needed to transport and to store those vaccines. And finally, also governments need to guarantee the authenticity of the vaccines that are administered to their citizens. The question is this really a true vaccine or is it a fake one? And this is something that is the obligation also for the governments. All those challenges are essential and need to be dealt with even before we start thinking about providing a proof of vaccination. As an integrated holistic approach, dealing from the, we need to look at it as an integrated holistic approach, dealing from the manufacturer, the pharmaceutical companies, all the way down to the patients. Although this is not the topic of today, it is importantly enough to mention it and highlight it. And there exist systems that are ensure a seamless journey along the supply chain for those vaccines. And they should be investigated and used by the authorities. But let's now go back to the right-hand side of our vaccination value chain, where the digital green passes are located.
Excuse me, Geert, you have almost 1 minute left.
Okay, my God, so it went quicker than. So I wanted to highlight something on the identification part, which is linked to, which is used in Europe and which is linked to this entire thing. So when we see that there are still some important topics and challenges, and I think we touched on this during the previous discussion as well. These are discussions about whether do we need an identity as part of our vaccination pass. I think there's those challenges that can give an answer to the identification at the moment of organization. Who will we invite? At which order will we invite? But there are also having an identification will provide challenges when linking the vaccine to the patient, and especially when we think about a booster or a second or vaccines with the second dose, in which we need to assure that the people that show up will receive the same kind of vaccine as they did in the first place. And there's also, of course, challenges around the identification when we provide an attestation of the vaccination. How do we know that the bearer of the attestation is really the person that received the vaccine? If you now look at the Digital Green Certificate of Europe, we can see that there's a link as part of the between the vaccine or the certificate between the person itself and the certificate, that the link is made throughout the certificate itself. Certificate contains an identification of the person, name, first name, date of birth, but there's also an optional link to a verifiable identifier. And it is left.
Your time is up.
Okay.
Okay. So actually, we're going to have Pavlina, and then we'll bring both of you for discussion.
Okay.
So Pavlina, Geert, stand by. Sure. And Pavlina, the floor is yours, and please present your prepared remarks.
Thank you, Joseph. Good morning and good afternoon, everyone. So just let me to share my screen. So let me introduce myself. I'm Pavlina Navratilova. I'm a market manager responsible for national identity and healthcare in Idemia. And I'm currently leading Health Travel Pass initiative. So it's a pleasure for me to participate in this LiveCast about this very current topic. So as we have already discussed, we have already covered a lot of issues around health pass certificates. I perceive personally there is three main issues that we all tackle with. There is a fraud in health certificate that appears on the market because the certificates are in different forms. It's usually paper or PDF, and it's not signed by any trusted authority. The second issue is that there is a lack of trust of governments in these health certificates because there is no proof, no digital signature seal behind. And also there are existing various formats on the market from different providers, from different technology company that usually lack standardization and interoperability. So these are the key issues I think that we currently tackle with. So as I mentioned, the interoperability and the harmonization is the key to enable all these certificates to be verified easily for the cross-border traveler while ensuring the high level of the security and the trust. So I would like to present you the main standardization initiatives focused on the health certificates and its specificities. So as Geert mentioned, he was speaking more about European digital green certificates, but of course there is also importance to remind the World Health Organization and ICAO and how they work together and what are the key insights where they have the joint paths. So all these international organizations play very important role to making this happen and to bring this interoperability and harmonization in place. So World Health Organization, ICAO, and European Union have set up a dedicated working groups to provide specifications of the health certificates, and they target different type of health certificates. So World Health Organization is focusing mainly on the proof of vaccination and specifying the smart vaccination certificate, which is a digital version of the yellow card for the current COVID purpose. The released interim guidance serves as a complete guidance document for governments to enable them the necessary infrastructure for this solution and to specify this infrastructure. ICAO is more focused on the visible digital seals, basically 2D barcode that was originally used for the non-electronic documents, travel documents such as visa, and which has been updated for the health certificate purpose and enables interoperability worldwide. And then we have European Union that is working on the digital green certificate, which will include various health certificates. So it can be proof of vaccination, PCR test, or immunity testing to ensure the inclusion for all the travelers. So you can see on the timeline below that all these standards are well in advance, and especially ICAO Visible Digital Seal, we just officially released the final technical specification just a few days ago. The European Union has already released its first regulation proposal in March 17, followed by a World Health Organization issuing the first release candidate in March 19. So they are going to finalize their guidance and regulation in the horizon of 2 months. What are the key insights from this specification? So these are all standard bodies and institutions. They mentioned that there should be multiple technological solutions that should coexist from different stakeholders. So there shouldn't be just one solution that should rule all the world, but of course there should be some harmonization between the different solutions that already exist. They mentioned that the governments are considered as the trusted actors in issuing health certificates and in guaranteeing its authenticity. And also that it would be much more simpler if we could already leverage existing either PKI infrastructure that are used for issuance, for example, or for encryption for passport or ID cards, or we could set up similar PKI infrastructures that should be designed for the health certificates. Anyway, they propose that it would be advantage for all if we could use the infrastructure we are already used to, the governments are used to. For the verification of the certificates, there will be international public key directories that will be operated either by World Health Organization or European Union. European Union call it European Gateway. to facilitate the verification process of the health certificate. So each country will be able to share their master list with the public keys for the verification of the digital seal. And the last step between all this discussion is basically to align on the harmonization of the data set that will be used. So, for example, World Health Organization mentioned as voluntary to use identity document. On the other side, European Union and ICO are currently specifying that there is a unique identifier that could be used in these data sets. So, as Geert mentioned, he mentioned basically what are the challenges.
You have almost 1 minute left.
And I would like to mention what are the key good practices all these standardizations promote. So interoperability based on international ICO standard, the issuance by the governments that are the trusted authorities to issue health certificate and to seal it with digital seal, online and offline verification. We should enable the verifiers even without an internet connection to be capable to verify the QR codes. Inclusion for all, it means that health passes should be in different form factors. So either a paper format, digital or PDF. And should be also available, the certificates should be the various certificates, so either vaccination, PCR test or the immunity testing. And of course, the solution should be based on a privacy by design and protection of data of the travelers. So just to sum up the Idemia position along the whole value chain, we propose the solution for the issuance, for the verification, and for the presentation for travelers. For issuance, what the currently states need is to install the public key infrastructure and to issue ICO visible digital seal to sealed documents. For the travelers, you can provide citizens with various forms which is more convenient and accessible to all, because not everyone have a mobile application to be used. And for the verification, we can have different solutions. So either it can be upgrade of the current infrastructure of kiosk and e-gates, or it can be a verification application that can be provided for the personal, for example, at the airport.
Okay, thank you.
Briefly from my side.
Thank you very much. Okay, let's bring the two of you together. Got a quick question. Actually, where is Geert? Operator, could you bring in the panelist? Okay, so just very quickly, what is the European Gateway and what role it's going to play in this initiative? Geert, have you been following the discussions around the development?
Yeah, sure, of course. Yeah. So the way Europe is in fact introducing it, because this is a point we didn't touch, is the trust framework that they will be applying. And so Europe have been decided to make use of what they call a private key infrastructure, PKI-based infrastructure, in which each country, each issuing country will sign the certificate they will issue. There is indeed a framework in which the European Commission plays a kind of a supranational role in which they will exchange the different keys between the different countries. And it's that way, in fact, that the validity and the trust on the certificate when checked will be controlled through this gateway and through this exchange of private and public keys. So
the European Gateway is the analog of the PKD of ICO?
Indeed, yes. This is the way that they proceed with it and the way they want to do it. But of course, it is a kind of a specific implementation of this standards, and it is being used within Europe only. And if you would extend it, of course, to a broader scheme, there would be something needed that would also play this role, which currently Europe wants to play or is playing for its member states.
Now, it's either you, Pavlina, or Geert, who is going to sign the European Green Pass? Because now we've got the European Gateway, which is we're able to authenticate that the pass is really genuine. But who signs the pass and issues the pass? Are you going to let the labs do that, or will it be the ministries of health of the European member states?
So it's on the level of European member states to set up their own infrastructure, and the European Union, of course, can support them in this initiative. This is the objective of this initiative of European Green Pass. And of course, then the issuance of the keys will be managed by country signing a certification authority. And the PK infrastructure can be either the standalone infrastructure, or they can already use the current infrastructure for passport and IDs if they are willing to.
So basically, member states, the laboratory lab results are supposedly going to go into some sort of national registry that proves that this person has been vaccinated. Then the national registry, there's an authority that will issue some sort of a pass that's been signed. And then when you travel through other countries, the European gateway will be used to verify that this pass has been issued genuinely to the individual. Is there any digital ID there requirement, or is it just name and date of birth? Geert, do you know?
Yes, so currently within the certificate, there is, in fact, what they did is they have the identity part, which is name, first name and date of birth, which is an obligatory part. And there is an optional part in which they say this is a verified credential. And so there is a link, it is an optional part in which verifiable credentials, such as, for instance, an ID card for a member state that contains one, or even a link to a health system, and even also a passport could be used to have this verifiable identifier for a person.
Right, and basically, Pavlina, how do you see the private sector using this? I mean, when we talked about the objective of this was to facilitate the free movement of people, and we were told that this is time limited. Do you see the private sector using it, and in what way? Apart from trains and apart from planes asking you to do this, are there any other allowed uses of the European Green Pass, or have they said they will ban certain uses?
Well, there are no uses that are banned, but the origin of this initiative is of course cross-border verification of the health status of the traveler, because this is the key how to avoid spreading a virus across borders. Of course, you can also verify the health status within the country, and for this reason, you can still use the verification of this sealed health certificate, because basically the purpose is to guarantee that the health certificate is the right trusted one. And in this case, it can be also other parties that could verify it. So it's not only limited to the traveler use case, but the traveler use case is the key driver of this initiative.
Okay, thank you. Just finally, Geert, what is the vision that Europe has for third-party nationals? Clearly, people who are entering Europe will need to circulate as well. Will they be required to apply and get a European Green Pass, or how does it work?
So yeah, the trust is in fact based on a number of predefined types of vaccines that Europe is putting forward. Currently, they're putting forward 4 agreed type of vaccines. There's also on the testing, the same kind of set applies. There is an agreed set of tests that can be used to obtain this positive or negative COVID test. And as it is looking from outside, getting back into the European continent, people will need to comply to these elements, which means there will be the need for a trust, and which means people will have this vaccine received, and they comply to the trust, they will be able to get into Europe as well.
Mm-hmm. Okay, excellent. We ran out of time. I thank both of you for this wonderful quick overview of the European Green Pass. While the operator prepares the second panel is actually not going to be a panel, it's going to be a sequence of presentations. I'd like to run one final poll, because Europe thinks that these credentials are short-lived, or at least they built them up to be short-lived. So we want to ask you a quick question. Can you put up the poll, operator? How do you see the future of COVID vaccination credentials? They will stay with us permanently to be used only for international travel. They will stay with us permanently to be used for travel, employment, and socializing, so everyday life. Will disappear in a couple of years as the pandemic dies out. So please vote. This is our last chance to get your insight about this important question. And operator, in the meantime, prepare the next portion of this session, where we're going to talk about repurposing some technology that's been proven in order to offer new innovative solutions to the question of COVID credentialing. Okay, operator, stop the poll and give us the results. This is quite interesting. We're getting 1/3, 1/3, 1/3, a complete split between everybody. So operator, put it up for the YouTube audience, and let's bring in the, okay, so it's amazing. So some of you believe that this will only be used for international travel. Some of you believe will be used for travel, employment, socializing. So it's very, very much ingrained in our society. And the third of that really believe it will disappear in a couple of years. That means we are really split. This is one of the most important insights I've gotten from you today with the polling. Thank you for that. Okay, for this session, I remind you that the speaker will have 8 minutes chrono on the clock, but then audience, you have specific questions to ask for that speaker. So please, I encourage you to put your questions, not general questions, but questions for the speaker, starting with this session. Rob, thank you for joining us. Rob from BurstIQ, the floor is yours.
Thank you, Dr. Atick. Let me pull my presentation. Okay. Can everyone see this okay?
Yes.
Thank you very much. So I'm Rob Lubeck. I'm the Chief Growth Officer at BurstIQ, and it's such a pleasure to be part of this panel. Really briefly, BurstIQ has been in business for about 5 years. And we have built a blockchain-enabled global digital exchange platform, purpose-built really for healthcare and identity data. So in the US, there's just been an absolute horrendous rollout for vaccine administration and testing, sign-up solutions, the scheduling features, the accountability and traceability has just been kind of a fiasco. I think we're finally getting better, but for the first few months, it's been really horrendous, and so much improvement needs to be done as we continue to roll out both vaccines and testing. So we have a proven field testing solution, both for administration and for testing. It's plug and play configurable, and it operates on our purpose-built healthcare blockchain to really enhance security and interoperability for both traceability and the end results. So we have built what's called the life graph, and that's really kind of the core solution for our platform or our data exchange. And life graphs are really a more holistic view of the entire health and identity system. So vaccine administration would be one part of a life graph for a patient. The testing can be another part of their life graph. The vaccine kind of supply chain to make sure that there's no recalls on either the vaccine or the diluents, all the way from manufacturing to needle and arm, can also be its own life graph. So we can combine all these life graphs together to make a much more holistic and comprehensive view of the entire health and identity kind of ecosystem. So the solution that we developed, and we're working with a lot of partners, kind of on the patient side, we've got, and once again, these are all modules. So we have the scheduling and follow-up, ADR reporting, a telemedicine option. We do have the ability for a COVID passport on the back end. On the provider applications, we have full recall and event tracking, inventory management, making sure that things are thawed correctly, that there's, once again, no recalls on the stuff. We have a full RCM module for billing if that's required, and then command center analytics. So there's a full view, visual dashboards. So at a real time, anybody can look and see what's going on in the ecosystem. And then this is really where the BurstIQ plays in most. So we are the blockchain platform. We are the single source of truth. So all the data is written onto our platform. And then we handle all the security, the governance, the consent rules and workflow optimization, and also any integrations that are required, whether it's a state registry or the CDC registry or government registry, we handle all that integration points as well. So once again, we have full command center AI and analytics. These can be customized to whatever information any user needs to see. They can also be provisioned, so different users can have different access roles where somebody might have access to PHI or PI information, and other groups or individuals may not. Once again, this is real time, and you can see what's going on in the entire ecosystem to ensure that things are going the way that you need to. This could be from inventory, from supply, to injection, to actually the administration of vaccines, all the way to the testing side of things. And then we do have a registry. It is accessible, it's verifiable, it's testable, interoperable with any other system. And we also have the ability to offer complete control and sharing of the registry, whether it's both vaccine administration and testing. We're supporting all the current and have the ability to support all the future standards as well. So W3C, health wallets, digital identities, it really runs the gamut of what we're able to do. And that's it. I'm going to be a little short of time, but that'll leave more room for questions if anybody has that.
Yes, actually, Rob, thank you. I will turn on my video. Okay, wonderful. So Rob, speak a little bit about the type of testing that's integrated into your platform. Are these self-testing kits, or are they testing that have to be conducted at the laboratories, accredited laboratories?
So we've started on the laboratories. So we've got integration with the laboratories so we can get real-time test results and integration. We are working on a solution right now with some labs to do kind of the at-home testing where they can actually scan barcodes and scan results. So we need to ensure that the tests are still testable and verifiable. And at home opens up a whole nother issues around that. But we're working on systems with a couple of labs, at least in the US, to solve that by actually doing scans and reading versus user input, which can create room for error and everything else.
Let me recount to you an anecdotal situation that just happened yesterday in a border crossing scenario between two European countries. I'm aware of it because I was on the phone trying to resolve the issue that happened. An individual was supposed to have a test result, and because of some language confusion, they thought that they could take the test on the train and demonstrate it when they arrive at Strasbourg and demonstrate the results. Or they could have had the laboratory results from you can imagine, this is Germany to France, and show that they've got a piece of paper with a barcode. There's no result on it, positive or negative. The barcode would be scanned and then would come back with the result demonstrating if it's positive or negative. So what happened is this person took the test and this person was negative. The problem was when the officer came and looked at the result and he said, where is the notarization? You took the test, so where is the notarization? Is there a witness that has witnessed the fact that it was an event related to you? And so that person was basically not, the result was not valid, not because the test is not valid, but there was a missing element of notarization. Do you have any framework that can help build notarization for these test systems, especially the ones we do self-administered?
It's a great question. And we have that capability. We've not gone down that road yet. The question is, who would have to be that third-party validator? And so that opens up another sets of questions. If we can identify who is approved to be kind of that attestator or that other identifier, then yes, we can build that into the system. And we've got ways to authenticate identity and everything else. So depending on the laws, yes, we could do that, but we'd have to figure out who that would have to be to ensure that we're going to be in compliance with those rules and regulations.
Right. The proposal was basically to allow a border control officer to be the notarizer because he's witnessing the test, but they refused because the tests take 3 to 5 minutes in some cases, and they were like, I don't want to do that. But there could be clever ideas where you could use your cell phone, where it shows that you're actually doing it, and then you demonstrate the clip. If there are innovations like that, I would beg you to solve this problem, because it was really a problem yesterday.
No, I love that. I appreciate that. And I will add that to our radar to start thinking about how we can solve that solution, because you're right, that's going to be a big issue. And we've solved it on the lab administered test. We've got pop-ups going up in New York and everything else that we're helping enable. But you're right, the self-testing just creates a whole lot of other questions and issues to solve.
Okay. Who are your clients? I mean, who do you sell this to?
So we sell it to governments. We've been in the state of Pennsylvania. We're rolling out a solution in New York. We supported the Masters golf tournament a few weeks ago. And then we're also working with private companies that want to do testing, even summer camps right now. We're working on, they want to have all their employees tested before they go live. And then be outside of the kind of COVID world, we deal with the kind of large pharmas and large provider networks and life sciences companies primarily.
Okay. And what's your roadmap now? Where are you going? Where are you going with this? Do you have any innovations in the live graph has become sort of a small element of this, but it has a potential to be much bigger than what you're using it for the COVID.
Correct. That is the future of BurstIQ is this live graph. And it's really, we want to open up the entire health information. We want to put more control in the patient's hands. And we also wanted to move all of kind of this research and development. You know, all these other companies make so much money off of patients' data, whether it's 23andMe or even Facebook, and that's the way they monetize. We want to put the control back in the patient's hands so they can help and also to be part of that monetization effort when their data is being used for research and clinical trial efforts and everything else. So the life graph is very encompassing. And right now we're focusing, of course, on health and identity data, but we're also working on a whole kind of provider credentialing network and nurse learning network. There's so many directions, and we want to make that life graph as holistic and encompassing as possible.
Actually, while we're raising this issue, Chris Justice has sent a message saying they are thinking and they have a potential solution in telemedicine for self-verification, for attestation. Chris, do you want to come on board and just say a few words about it? If you don't mind, Rob, it'd be interesting to have that discussion.
I would love to hear this. Thank you.
Yeah, Chris, can you come on board?
Sure.
Operator, elevate Chris.
Sure. Hi, everyone. Yeah, Rob, great presentation. Really interesting how you're leveraging the technology to kind of do a holistic framework. You know, we're working with a couple of groups who are doing the lab testing in the UK and also in the US, who are using it for travel, basically doing telemedicine, sending a kit, and whether it's PCR or rapid antigen, sending a kit out, and then they have a telemedicine platform that basically allows that test taking to be watched, and then attested with the result. You know, and a rapid antigen, then you get the result right away or within 15 minutes. Or if it's a PCR, you know, put back in the package and mailed back to the lab. We actually think that, and then they're also, for travel, they're basically sending out an extra test so that when the person from the UK goes to Greece or Romania for, you know, holiday this summer, they've got the test with them.
Yeah.
And then they just basically take the test, they call up the telemedicine, they take the test while they're in Romania in order to be able to get back into the UK. That way they don't have to figure out testing. You know, where am I going to go in Romania or Greece? Where am I going to go and get a test, you know, that's going to be acceptable for the UK when they return home?
I mean,
really interesting and a good way of integrating into your platform, maybe.
Right. Chris, this is exactly what happened. The person did have the test, but the problem was the attestation. The missing link that you're providing is this telemedicine. If this is a service, this is phenomenal. I mean, really allowing people, this would be phenomenal for the African continent, which is basically you've got these tests that you take with you, and then you're able to do the test just before you board the plane, and it is attested to by a telemedicine operator, and therefore the trust can be increased and enhanced. Gentlemen, this discussion would be phenomenal if we follow it up in the future with a concrete answer, concrete solution, it will make a difference in people's lives. Because what happened yesterday was something that I testified, that I saw, and it was a question of integrity that I would have had to, if I had to intervene, I would have said, you know, this person surely is honest and decent, but this is a character reference. We don't want to be doing such a thing. Luckily, it did not take place. Luckily, nothing serious happened, but I could see the outcome could have gone in the wrong way. So yes, telemedicine, self-testing could make a huge difference in building the chain of trust for COVID. So thank you for that addition. Thanks, Chris, and thanks, Rob. I'd love to stay with you, but we've got more things to cover, more repurposing technologies to look at. So Rob, thank you again, and we will be seeing you soon. Okay, Mitchell, thank you for joining us. The floor is yours.
All right, thank you, Dr. Atick. Thank you, everyone. Such a well-organized event, I must say. It's been quite an honor and a privilege to see the other solutions out there over the last two other sessions and today. Okay, so I think what I would like to do is share my screen. Let's go here, and then I think we need to swap it. Getting that 1 second. Oh, I'm not able to swap my screen. Oh, I'm sorry. Yeah.
You are visible.
Yep. Okay. Great. Sorry about that. Is my screen, my deck visible as well?
Can you please press swap displays?
Yeah, I just did. Okay.
Okay. There may be a delay. It hasn't changed yet. That's
there.
Perfect. Okay. Thank you.
Okay. So thanks, everyone. So again, my name is Mitchell Dion, and I'm the CPO at SPEN. SPEN is a fintech solution headquartered in Norway that provides financial services to emerging markets. We've been in business for about 5 years, and we operate in Rwanda, Tanzania, Zambia, and the Philippines, with a keen focus on regional expansion in Africa. So I think for the same reasons that there are nearly, I think, 350 million unbanked or underbanked adults in sub-Saharan Africa, there are likely the same reasons why the vaccine prevalence rates in that region is quite poor. So namely poor infrastructure, lack of financial health education, trust, and institutional transparency. So don't get me wrong, I mean, we're very optimistic about the improvements and positive trends in Africa, but there's still a ways to go. So what we've developed is a smart financial platform with an underlying blockchain component that is a user-friendly mobile banking app. And we do this by partnering with local banks and with the central bank to effectively digitize the national currency. So some of you may have heard about central bank digital currencies and whatnot, which are quite in vogue at the moment. Well, we've been doing that for nearly 5 years at a kind of a private level. So we basically create an ecosystem where the unbanked, the bank, the banks themselves and merchants can all interact with one another. So I think it's important to establish that context as to why a fintech would be interested in extending a health certificate on their platform. So briefly, as you can see, we offer users the ability to do all sorts of things: deposit, send, spend, save, borrow, buy cryptocurrencies, and soon be able to share their vaccine credential. And so because we're focused on financial inclusion at our core, we believe that a healthy user is a user that is participating in a strong economy. So often is the case that a family member becomes ill, whether COVID, tuberculosis, whatever it may be, and this causes tremendous disruption within the family unit. And so I really must admit, I do have an extensive identity background. It's great to see a lot of familiar names and companies here. But the idea really didn't fully crystallize for me until I was speaking with a colleague recently at the Gates Foundation, because I've moved into the fintech space now. And Gates Foundation, as you know, financial inclusion and health delivery solutions are a key priority. and that it really clicked for me that being able to store that credential in a secure wallet with a user base of nearly 1 million users that have been KYC'd. Many of them do not have a credit card, do not have a bank account. So, you know, this represents within the Spend platform a really unique position to offer this ability for our users to store a bona fide credential within their KYC'd wallet. So let me give you an example. In 2018, we were working with the UN Development Women's Fund, where we partnered with the UN to deliver let's say, some funds from the UN headquarters in New York to the women in the refugee camp in Kakuma. So if they had the app, we sent $100 or the equivalent of to these users, and it came directly right into their Spend wallet, cash, which allows them to do whatever they feel is necessary for the family. And so there were no middlemen, nothing like this, and it worked just like a charm. So, you know, if you're a government agency and you're looking for a way to target a specific set of citizens to incentivize them to go out and get vaccinated, then I think leveraging a third-party app like Spend, or, you know, there's others out there, transportation apps, insurance tech, whatever it may be, I think is a very good option, because you're basically repurposing these apps that are already well entrenched in your markets. So how do we do it? So we work with governments, NGOs, private clinics to really act as a bridge to allow our users to accept their credential on our wallet. So you see here that we already have a user profile within the app that allows users to refer to others or store their profile details. And so what we've done is we just basically added a button that launches into a customer journey that allows a user to add an existing physical document by way of photo, or if they've received a digital credential, then the user can either scan the QR code or ping a government API to query for that record. So for the photo upload, we have a customer support team that's already, you know, on the ground, in the bush, in the rural areas, that are able to do that validation and that KYC process. So training them to validate one more piece of paper or one more record is not too much of a stretch. And then that would allow them to, you know, okay or not okay the user. And so this isn't limited to Spend. I mean, I believe if you have a secure government grade, bank grade mobile application, then I think that this could be really something to look at. It's just, for me, it's kind of made sense to me that we have these credential systems out there, lots of good solutions I've seen today. Here you have these third-party apps that are out there that are already being used. Why not marry the two to get the word out? So what we have here is a typical user flow from registration to the sharing of credentials. We start with the vaccination site done by the health admins. We're trained to verify the identity of the user. Depending on the jurisdiction, this can either be a mobile number or an ID document. Vaccine data is uploaded to the central database. And to clarify, Spend is not interested in storing any private health data. That is strictly the domain of our partners. So we create a one-time password created for the citizen with the relevant data, and now only that anonymous record is linked to that user containing a QR code. Also note that we are not storing the record on the device. We're only storing that link to the record. So that may change in the future once we determine the legality and the security of storing a credential that could potentially be used in an offline scenario. Still not there yet. We're still not comfortable with the regulations. And so now with that QR code.
Just about 1 minute left.
Yep, okay. So I think it's pretty straightforward. So let me move on. So this is pretty self-explanatory. We are focusing purely on domestic use only, maybe USSD feature phone coming up, and then when phase 3, international travel conformance. And then finally, for us, the main driver at the moment is Rwanda. We have just signed, or in the process of signing, a deal with the Rwanda Biomedical Center, which is the outreach arm for the Ministry of Health, to include the Rwanda or RBC health credential within the Spend Health app. So I guess I can say only that I encourage other third-party solutions such as fintechs, insurtech apps, transportation apps to think about how they can integrate a health credential solution onto their platform. As I mentioned before, healthy citizens needs a strong economy. Thank you.
Thank you. Thank you, Mitchell. It's definitely an interesting strategy, an interesting philosophy, repurposing something that's already in people's hands, that they're comfortable using it, etc. my concern is about penetration with this type of solution. You talked about financial inclusion, and your platform seems to require a mobile phone that's a smart mobile phone. How can you reconcile the two issues of
Sure. Yeah, so we're based on a smartphone level at the moment, but as I mentioned previously in a slide there, is that we are looking at doing USSD functionality. So this would be for analog phones, you know, *149 this, *123 for that. So we're still looking into that. And I think there is a large number of users, obviously, in sub-Saharan Africa that are still using analog phones. But I don't think that this is too far away, Dr. Atick, because you're already seeing the mobile money providers and these telcos that are already securing moving of funds by analog phone. And so being able to attest to a credential or maybe having to call in or doing something like this, I think it's technically feasible. We just need to figure out how to put the right parts in place.
Let me ask you, if it turns out that a reasonably advanced phone, more than a feature phone, is required to help the African populations basically benefit and participate from the fruits of development, why can't we, for example, work with the international development community, the government, etc., and put together programs to convince them that in order to help their citizens, maybe instead of cash transfers, maybe give them a mobile phone and build on it a set of government services that make them more efficient and will give you a return on investment. Is that something that you have been exploring in Africa? And if so, what has been the response to that?
Yeah, you've nailed it. So this has been started by a number of NGOs, and I think there's some really great programs out there that are reaching out to the rural farming community that need to be able to take loans out, for example, or to be able to communicate. So there is incentives and I would say programs in place to be able to get those smartphones out to users. You know, it's also a security issue, and so it's a price to security issue. So you have cheaper and cheaper smartphones coming out all the time. So I think now you can get something for between $25 to $35, something like this. So it almost makes sense if you're going to incentivize someone to get a vaccine to be able to offset that by offering them a smartphone, because the price point is nearly there.
Exactly. And in fact, this is one of the policy initiatives that ID for Africa has advocated, and we are going to visit that on Identity Day. We have a set of 6 or 7 policy initiatives that we are going to unveil that we've been working, but we would like to get input on, and I would love to connect with you to see to what extent in the financial inclusion world and in the world of vaccination that you've been working on, whether such an incentive, a policy incentive, would have some interest from the NGOs and the governments that you've been interacting with. But it's definitely,
sure.
I am not of the opinion that we should push Africa's level down. We should try to lift Africa's level up.
Absolutely. Absolutely.
By helping them acquire the tools that they're going to need, instead of saying, no, you're going to stay with feature phone. That's why we're going to forever work with feature phone, in which case it's limited. So there's a transition and we got to work on that. But the question is, the development agenda needs to ask what are the pillars of drivers, and this may be one of them.
Sure.
So,
well, it's going to become increasingly more difficult. You know, it's particularly in Rwanda, they have a goal of 30% vaccinated by this year, another 30 next year. But then when you start to get to year 2, 3, 4, it's going to become very difficult to get those last people to get that vaccine. So we have to find a way to incentivize them.
Exactly. I agree with you. Yep. Mitchell, we're running out of time. Thank you so much. Wonderful presentation.
No, very good. Thank you.
We look forward to seeing you again. Okay. Thank you.
All right,
Operator, bring in the next. Ilja Hofmann from OVD Kinegram. Welcome.
Yes.
The floor is yours.
Thank you very much. And first of all, amazing organization as usual. It's a great value for Africa, I have to say. Let me share my screen. You should be able to see it now. Can you see my screen right now?
We see it, Ilja, but could you go into presenter mode, please?
Yeah, for sure.
Okay, great.
Sorry, I have to double click it, and there's a last click to do.
Perfect, thank you.
Perfect. Okay, let's start. We started basically in early 2019 to develop an identification solution which could be used as students' ID, voters' card, or proof of enrollment. I want to make very clear that it's a physical solution. It's a paper-based solution. At the beginning of the pandemic, we realized that this innovative solution would be perfect as a physical document to prove vaccination status, either as a standalone solution in Africa or as a physical credential for a digital solution. I think, especially in Africa, because I'm an expert of Africa, I lived there 35 years. For the market in Africa, you need both, either digital solution as well as a very strong paper solution. As we have more than 30 running projects on the African continent, we took in consideration existing local infrastructures and existing budgetary restraints. Together with our local partner and our R&D department, we defined 3 main requirements. The first requirement was that this document has to be extremely secure, meaning the substrate in itself, as well as a personalization. The other requirement was that it had to be affordable and durable, meaning resistant to chemical abrasion, temperatures, humidity, and exposure to sunlight. Last but not least requirement, that it had to work everywhere, anytime, with or without personalization equipment. I can tell you that was not an easy task, but I think we come up with a nice solution. I would like to go a little bit back to the continent I love, to Africa. We have to realize that 50% of the population in Africa does not have a smartphone, and that 500 million people don't have any means to identify themselves. That means that sometimes they don't even have a birth certificate. In our opinion, a vaccination certificate must have 2 components: a strong digital solution and a robust physical token. The main aim should be for sure to avoid exclusion. I have been the last months, I have visited several health ministries in Africa, in Mali, in Nigeria, in Benin, as well as in Ghana, and they're all fighting with the same problems. What they want is to vaccinate their population, so they really need a solution which is easy to implement. They need, on top of it, a solution which is inclusive. They need a solution which is flexible and which is convenient. I see a great chance, it's the only chance I see in this COVID pandemic, it could be the chance to provide 100% identification means for the African population. Let me go a little bit further. So what you can see here is the solution. This is an example of an ID1 card in ID1 format, but other formats are possible. It is highly secure from the substrate based here because it has UV features, it has security print, it has a watermark. And on top of it, it has a cold laminate. You will see later how the system works. It's a Kinegram laminate. It's a laminate used in a lot of passports, ID cards, and banknotes. So it's extremely secure. It is easy to verify, even with an untrained person, and it can even be identified digitally. It's an affordable solution. It's a paper-based solution, and it's very durable. The laminate not only protects the card, but it even gives it a longer lifespan. We have tested this card comparable to a PVC card, and we came roughly to the same results. And the card works everywhere. I will show you now the workflow. I will be quite fast, forgive me, but at least you will have a little bit more time for questions. The workflow is very easy. We supply the substrate on an A4 sheet. You can personalize it either with a laptop or even manually by hand. You print it in the case of a laptop personalization, and then you fold it and you protect it. The possibilities basically are endless. Here you can see a design we made for a customer. but any design, either of the laminate or the card, can be made. So you can print on it a QR code, a picture, and in some areas in Africa, it's very important. You must be able to fill it manually, put a stamp, and even sign it. Once this process is done, you can fold the card, and the card is highly secured. If you need more information about this product, there's a QR code. You can just scan it. We made a very nice video. Thank you very much for your attention, and I hope we can be part of the solution on the paper side.
Thank you, Ilja. This is definitely interesting to me personally, because I strongly believe that Africa needs a physical solution. I've got a couple of things that I'm wondering about your particular solution.
Yes.
You talked about its durability, but our immunity may not be as durable as your card. So is there a way we can make these cards secure but updatable, so that as I get booster shots or as I go on a year later and I get it again? In this model, I imagine you have to keep reissuing the card, but in which case this is a waste, because immunity durability may not be as durable as your card.
Yes, definitely. If there's a change in the vaccination process, or you have to be vaccinated once again, you have to issue the card again.
Right.
We took in consideration the African environment where I'm very often, and you have to realize that it's a very hot climate. People might not have a purse, because if you're in Nigeria, for example, you will run out with packets of Naira this size. So when we say durable, it's always comparable to a PVC card.
Okay. There's a question from Frank Darko Ajiri. 3 questions, actually. Is your solution backed by ISO standard?
Yes, we made some ISO tests. I think it's I don't find it back here because I'm not a technician, if I have to say. We have tested following the ISO standard 10373.
Okay.
So which is basically the standard procedure to test PVC cards.
Okay. The second question, is it at least compliant to WHO's standard on data?
We think it's completely compliant, because you can print on it or you can personalize it. You can put whatever you want on it, whether it's a QR code, a picture, or any kind of data. This is an advantage of this card too, because if law changes in a country, or you go, for example, in different regions, you can personalize it, put a different logo on it, put a different ministry logo on it. This is really up to you. We really want to provide the support. We're not against digital solution. I think we want to work with digital solutions. But what I saw from now is often printed on an A4 sheet. And from our perspective as security expert, this is not enough.
Okay. And his third question was, how tamper-proof is it?
We tested it. We think it's very tamper-proof. If you are really, we always make the difference in counterfeits. What is roadside? What most of the counterfeits, 90% are roadside counterfeits. For roadside counterfeits, it will be extremely difficult to counterfeit, because the laminate is used in ID cards and passport, and our technology is even used in the Schengen visa, for example. It's the same technology we use. If you are really a professional counterfeiter, yes, you can counterfeit everything, but you will not be able to do a mass production of the laminate. This is not possible because it requires investments of millions of dollars.
And explain to me, what's the cost model? Because you're talking about something in addition to the cost of the vaccination, that they have to issue this credential, which is now a physical credential. So what is the cost model?
Actually, in Africa, in Ghana, for example, or in Nigeria, people are already issuing those kind of cards, but they're not secured. It's just a carton card with a QR code on it. And I just had a discussion in Ghana, and we are basically cheaper than those non-secured cards.
Cheaper than the non-secure card?
Yes, definitely.
What are we talking about? 10 cents a card? 5 cents a card? I mean, what's the level, so I can understand where is this coming at?
I would like to give you an idea of it, but it's in this region. It all depends on the quantity, because there's a big printing process in it, a gluing process. We have to put several glues on it. So if you order 10 million cards or 100 million cards, that makes a huge difference.
Give me an idea. 10 million cards. ID for Africa is going to buy cards to give to the African nations, consolidate pool. I mean, because it's important for us to understand, is it $1? Is it 50 cents? Is it 5 cents? And we're not going to hold you to it. Just get an idea. Because, you know, physical solutions are important, I think, for Africa. And if we don't have a viable one, we continue to work with mobile phones, that's going to be a major problem. We need the physical dimension and securing the physical dimension through secure printing. So give me an idea.
Very difficult for me to give you an idea. It's definitely in the range. 400 million cards, I haven't calculated it, to be honest, so I will go for rather smaller quantities. But if you take an example like Benin, for example, which might have a need of 5 million cards, then it will be in the range definitely under 25 cents.
A card. 25 cents a card, including the personalization?
The personalization can be done on any printer.
On any printer.
We just give the support. It can be done on any available printer. And the good thing is, because sometimes I travel to regions where there is no electricity available, you can even fill it by hand. You can stamp it and you can sign it. I mean, not everybody is living in Lagos. Some people are living in Katsina and Sokoto.
Right. But that means that the security model depends on the supply chain security. If somebody steals those, then they can just give them out. That becomes really, really important. How do you track these? Are they audited and they've got serial numbers? How do you track them?
We can definitely put a serial number on the substrate. That's not a problem for us, but that's a problem you will find in ID cards and passports too.
Of course.
So the person issuing it definitely should have a central database where he puts on the serial number on it.
Okay. And there is no possibility that, I mean, you could build also like a belt and suspender model where it will have a barcode that can connect you to an online, and you can do another layer of verification so that you can deter people from thinking. Is that something that you're able to produce?
Yes, definitely. Definitely. But for now, I would say faking the original, counterfeiting the original document is already very difficult. The only thing which could happen is that people steal some cards.
Exactly.
But now we are not talking about a mass problem. If 2 or 3 or 5 or 10 cards get missing, it's not a question of national security. It's more a question of national safety.
Okay. Just one last question. Somebody's asking, is the QR code integrated, scannable? Obviously.
We don't provide the QR code. This is to all the person which have digital solution. What we provide is a safe and secure substrate.
Okay. Okay, no problem. Thank you so much. We look forward to seeing how it advances in Africa. Thank you for your contribution. Operator, please bring in the last segment, which will be slightly different of the event. And this will be essentially a video presentation by Mulbauer, followed by question and answer to close the session.
My name is Hilda Karashani. I'm joined by Louisa Stumbeck. We are both delighted to be here today to discuss the subject of vaccination certificates in light of the COVID-19 pandemic. We all long to go back to our normal lives. And to do this, we have to endure COVID tests, for example, PCR tests or antigen tests, or when possible, get vaccinated.
While testing and vaccinations follow set procedures, the certification of test results and the vaccination status has not been standardized. It is a manual process which is time-consuming and prone to errors. The non-standardized certification procedures and documents open the door to false and fraudulent certifications. In this time and age, more secure, faster, and trustworthy certification is possible. Digital health certificates hold the answer to a convenient and trusted certification. At Mulbauer, we have developed an ecosystem for the issuance of certificates.
How should a trusted solution look like?
In simple terms, you enable your medical centers to issue the certificates to the citizens, who can then use them wherever they go.
Interesting. So how does this whole process begin?
All this begins with the accreditation of the medical centers. The medical centers will apply for the registration and supply the necessary supporting documents. Once approval is granted, the centers then receive unique registration numbers. The individual medical centers can then use this registration number to connect to the public key infrastructure, where a derived certificate can be generated. The medical center from this point is now officially accredited.
It sounds great. The first step is achieved. The medical center has been accredited. Now let's shift our focus to the people.
Indeed. The first thing an individual would need to do is to get registered, after which they would receive an appointment at the nearest medical center. At the medical center, the identity of the citizen is verified and captured, later linked to the vaccine or test. The vaccination or test can then be performed and the database is updated accordingly. Once the database has been updated, a certificate will be generated.
What information does the certificate hold? In other words, include?
Well, it includes some personal data of the citizen for later verification, such as name, surname, and the identity number of the document to bind the certificate to an ID. In addition, the certificate includes data regarding the vaccination or test, such as the date of issuance, the date of expiry, the test status, as well as information on the test or vaccine itself and the medical center. Finally, the certificate is digitally signed with the necessary signatures.
Brilliant. Can you please elaborate? Who has access to the data? Is the personal data protected?
Of course. The ecosystem follows international privacy regulations, such as the GDPR. The app requires explicit consent of the device owner for sharing the data. Through the shared keys of the public key infrastructure, everyone can verify the digital signature of the data. This can include the medical centers, border controls, flight attendants, or anyone else who might need to verify your health status.
Very interesting. Though I must ask, how does a citizen get access to the certificate? According to a few studies, only 20 to 30% of the African citizens own a smartphone. How about the rest, the 70%?
Well, you see, the ecosystem is completely independent, meaning in case it was issued by smartphone, it would be displayed as a QR code or even saved as a digital token. However, it can also be transferred onto a health card, printed on visa pages, or printed on a sheet of paper as a QR code.
Please elaborate on the digital token of a smartphone. What exactly do you mean?
Imagine you are at the airport and you're in a hurry to get your flight. You can either queue in line to verify your documents, or you can use your digital identity combined with the digital health certificate to pass effortlessly through an automated gate. The digital token is your individual access key to your seamless travel.
So for those airports without automated gates, what would you suggest?
In this scenario, you would use a desktop QR code scanner, create a secured and dedicated connection to the public key infrastructure, and a specialized software tool will verify the validity of the certificate and the identity of the citizen.
How secure is the whole ecosystem?
We need to look at the security from two ends. It must be secure against impersonation and fraud. Firstly, citizens must be identified and verified before the vaccination or the test is carried out. Basic personal information name and ID number will be part of the certificate and will be displayed when the certificate is later used and verified. Therefore, only the one who has been vaccinated or tested can actually use the certificate. Secondly, the correct and rightful signature through the public key infrastructure can be verified in the field.
Thank you, Louisa, for joining me today and answering my questions.
Thank you, Hilda. And thank you for your attention. Please stay healthy, and we are looking forward to your questions.
Thank you very much. Thank you very much for this wonderful video. You've answered, in fact, many of the procedural questions and the operational questions related to this. Wanted to understand a little bit better about the interoperability model. Interoperability within the same country, but also interoperability of what you're producing as people move to travel to other countries. Do you see a need for another pass system that will use your system as an attestation and do a conversion to the other countries? Or do you think you can be in a place where you would allow third countries to verify that your pass is legitimate and attested to by the German government or by the government itself of the country that's deploying this solution? Could you explain that, please?
Thank you very much, Dr. Atick. Thanks everybody who has organized this wonderful session. In our scenario, you would use it in the same way we've used, for instance, as of today, we all travel and cross borders with these certificates. Yeah? So we would be in position to use it in that same style, like how the visa works. Yeah. So in that case, we keep the existing infrastructure, enhance it as secure as possible, but the movements would be then verified that the right person holding the right certificate can cross and be identified as the right holder.
How can a third country, some outside Europe, some outside the country that launched it, let's say you go to Indonesia and I have got your pass, how do I allow the government of Indonesia to verify something that was issued in France or Germany?
I think we are all basing ourselves on the ICAO compliance. These documents must have a standard that can allow you to go from east and west if you're going to Indonesia, if you're going to South Africa or USA. There's a standard which we'll have to uphold. So in that case, whichever way you're moving, the certification should be according to the standards of ICAO.
I understand, but the issue is you're not hosting the public key directory.
Exactly, the public key directory, exactly, yeah.
The public key directory is hosted by ICAO. In that case, would you basically say you are implementing the ICAO framework for these passes? Would this be a fair way of saying it? And would ICAO give you a certification for it?
Yeah, we use the same kind of framework, of course.
But you're not trying to create another initiative. You're creating basically a framework which realizes the ICAO specification, which I understand as of today, they've gotten an agreement on everything, and it was going through the approval process, and it will be issued shortly. So the framework is there. And how will that? I mean, obviously you've created an application, but is it fair to say that application has been built on the ICAO framework?
That's correct. We have built it on the ICAO framework, and we want to use standards which are consistent so that when you're moving, that interoperability is granted. That is very secure, that the movements and the processes keep in place as had been.
Okay. So we are following the respective ISO and ICAO framework and standards.
Okay, I mean, you've added other dimensions. For example, you recognize the importance of accreditation of the laboratories, that laboratories have to be accredited. and that the data that they produce has to be secured. And as you've seen today, we went into the session, we talked about the processes, the source of truth from where you extract your information goes all the way to the labs and the registry of vaccinated people. From then you issue them passes, and the passes are going to be essentially whatever the application wants it. If it's for travel, then you try to be an ICAO compliant. If it's going to be for other domestic applications, you could be very creative. You could add even a biometric or a facial recognition so that you don't have to show an ID at the same time. You can automate the process. Your platform is extensible to allow for the molding of the application into different types?
Yes, that's right. That's correct.
Okay, so you basically are offering a platform. Who are your customers?
We have had customers all over Africa. I didn't have a time to introduce myself. I'm in charge of East African community, and we have so many ID projects, over 300 ID projects, whereby you have to identify the right person holding the right document. And for that matter, we are going also in this case of the vaccination in the same direction to enhance a trustworthy setup, a landscape where you know the right person. For instance, we've had several cases now being talked about in Africa. We have to have secure certificates. So our customers in this case also concentrate majorly on the Africa continent.
Right. Ibrahim Adia asks Hilda, it's the system that you're talking about already used in Africa. Can you also supply your electronic address? And merci et félicitations. Thank you. Congratulations. So we're happy to connect you with Ibrahim Adia. Just connect with the operator afterwards and we can share. Unless you want to put in your address in the chat, you're welcome to do so. I think we've reached the point of the end. It's the operator is indicating that there are two people with raised hands from the community voices. I may be willing to take them if it is absolutely very, very quick and short, and it's very pertinent to what we're talking about. I see the hands went away, so no problem. Apparently, this was not pertinent to this discussion. Anyway,
sorry,
thank you
Dr.
very much.
In the room. Excuse me, Dr. Yes, we have the community voices in the room.
Okay, then bring them up and let's see what it is. If it's pertinent, we'll take them. If it's not pertinent, we'll thank them. Okay, bring them on.
Mr. Naranjan, can you please turn on your mic and video?
Yes, I see also Carl Stanecker is also on. I'm being sensitive to the time and we need to close this session. So please cooperate. Yes, Mr. Gosavi, state your purpose. Who are you and where do you come from?
So I come from India, and we are essentially into managing identity platform for the Department of Finance in India.
Okay.
And we have so far issued about over 250, 300 million QR codes, which are offline in nature and encrypted, but they are storing photograph and a signature inside. And all these QR codes are basically then verified in an offline environment, which does not require any internet connection.
So you basically reconstitute the photo of the person and then the human would verify that. Is that what you do?
Yes. Yeah. Okay. And basically when we store the photo, now we've moved to another level. We also do a face recognition of the same person.
Okay.
So basically a maker and a checker kind of a solution.
Okay. So that's definitely interesting for offline. Why don't you put a link to that in the chat so we can follow up and understand what you're doing?
Surely, sir. I'll do that. Thank you.
Thank you. Thank you very much.
Thank you.
Okay. This is the end. We have to stop here as much as we want to continue because of the interest that you're showing and the questions. We have to end. This is not just the end of this session. This is the end of the trilogy. I hope you found it very useful. It's been a month focused on a subject that is affecting our lives, and a subject that I expect will continue to be with us for a long, long time, as COVID would have to stay with us, and our recovery is not going to be simple as we try to find a new norm. I thank all of the panelists for their contributions. We've lost some of them because of the length of the session, but I'm hoping that the audience will be able to catch the wonderful presentations and contributions on the YouTube for the replay. So even if you attended live, I encourage you to go to YouTube and check it out, because it's just been a tour de force session with so many contributions and ideas. And so I hope you will come back for another very exciting session on democracy, which is coming up in May. It's coming up in May 26. So that's coming up in about 3 weeks. There, basically, we're bringing in the electoral commissions of Africa, we're bringing the think tanks and the innovators. So be there, and also, as I said, help us disseminate this. Please watch, like, share, and disseminate good quality information. Our community depends on everybody doing their part. So thank you, everybody. And with that, I sign off. Bye-bye.